Okay, so welcome to today's talk, and we will talk today about diabetes and especially diabetes in infants and juvenile diabetes. So, first of all, we need to understand that this disease requires a multi pronged approach, it cannot be treated only by one approach. So, first, let's understand what is happening in juvenile diabetes or diabetes in infants and children. Well, type 1 diabetes is a form of diabetes where almost no insulin is produced by the pancreas, and this results in very high blood sugar. Classic symptoms could be frequent urination, increased thirst, increased hunger, weight loss, vision issues, tiredness, faintings, vomitings, diarrhea at times. To be honest with you, cause is not very clear. Genetic is one of the causes that is known to be there. There can be environmental factors, drugs. Most of us know about the pathophysiology of how this kind of diabetes in children actually happen, and what basically happens is that the pancreatic cells which are destroyed, they can't produce insulin. Typically, we know what are the main symptoms of juvenile diabetes, that is polyuria, polydipsia, polyphagia, but a lot of weight loss, a lot of fatigue, weakness, unable to do anything. Typically, this diagram can show you a lot of things. You can see this picture, how the child can typically be. It's it's often an autoimmune component as well. Many of them are actually diagnosed at the time of diabetic ketoacidosis, where they develop dry skin, rapid breathing, drowsiness, increased thirst, frequent urination, abdominal pain, vomiting. What is the common symptoms of diabetic ketoacidosis? Fruity breath, Kussmaul's breathing, mental status is affected, abdominal pain, dehydration, and so on. There is a way to diagnose it, and one of the best is um, we check is the 3 month average, that is the HbA1c, and typically it really goes above. I have seen cases where the HbA1c goes about 10, about 12. There are many complications, including retinopathy, neuropathy, and so on. Well, one of the main thing that most of the modern medicine comes up with insulin therapy. But along with insulin, I want to tell you one of the most important is homeopathy. Homeopathy can be a good accessory to be given at times along with insulin, and we can reduce the insulin units. We have to go to the deeper state beyond the juvenile diabetes. And often the mother's history during pregnancy is a very important factor as well. I want to give you one case example. A 3 month baby, you could see the HbA1c was 10.2, came with diabetic ketoacidosis. Initially 465 blood sugar, HbA1c 10.8, not coming down, almost taking 40 units. In homeopathy, we understand the person, and we try to go at a deeper level and understand the whole gamut of symptoms. And the main symptoms were that she startles very easily. She constantly startles, cannot take strangers close to her, very restless, cannot sit in one place, very, very restless. Sweats, lot of sweating, especially sweat in the occiput. Doesn't like being at home, very, very hyperactive, restless. Scream, shouts. Whenever offered a chocolate, she makes a grumpy face. Wants to be with the mother constantly. Doesn't like the father. When father is there in the room, she gets very, very irritable. Sweats a lot. One of the main things that I found was constantly she's very, very restless and changing whatever she's doing, startling, clinging, and the sweat. And when I analyze all these symptoms in homeopathy, you can see this few symptoms, the way we analyze in repertory, constantly wanting to change his occupation. You can see the remedy there, sanicula, mood repulsive, again sanicula, attached to mother, occupation changing, again you see sanicula, person aversion to certain, sanicula. That's what I gave, and you can see instability of purpose, sanicula main remedy in that. And this is a very important remedy, occiput sweat, remember sanicula there. Sanicular 1M, I also later on gave in LM potency and I prescribed every month. At the end of 6 months, you can see the blood sugar HbA1c came to 7.1 from 10.1, and even the insulin units from 40 were reduced to 10 only with homeopathy. This is a remarkable change that homeopathy has a role along with modern medicine in this type of disease. And to all the parents who are watching this video, find a good homeopath and give your case to them. Now the child is doing so much better. Many cases have improved in this way. This is my email ID, and online consultations also I do, and my clinic is in Mumbai.